Hello. This video introduces Pathways-Based Client Engagement Support, PCES, web cloud technology developed by RT-Sync. PCES is a coordination technology for community health workers and care coordinators. Community health workers use Pathways to guide clients to resources and services and monitor and track their activities. A pathway defines the problem to be addressed, desired positive outcome, and key steps required to achieve the outcome. PCES provides outcome-based accountability and quantitative analysis for quality improvement. PCES is currently being applied to reduce overutilization of emergency medical services and emergency room readmissions at Prince George's County Health Department Population Management. PCES automates and replaces paper-based pathways. For example, obtaining transportation for a client is done through a pathway which provides the steps that are required and the options for available transportation open to a client. PCES targets community-based managed care organizations with underserved populations. PCES is a coordination platform with 5 types of participants: clients or patients, CHWs, nurse coordinators, supervisors, and data analysts. Each has their own web browser and access rights and restrictions. Pathways-based analytics help make decisions to improve community health quality and cost effectiveness. PCES works within an environment of workflow and pathways. Here's a use case involving emergency management services. A person has fainted with low blood sugar. A call to 911 is put in, which dispatches EMS to the caller's location. EMS stabilizes the client to alert and oriented status and hands off the client to the system. The nurse coordinator gets the EMS report and assigns the CHW. CHW visits the patient's home within 24 hours to obtain consent for further interaction using the system. The CHW does initial intake and consults with the nurse coordinator to select pathways appropriate to the client's condition. Along the way, the PCES provides status updates periodically, and the nurse coordinator is able to pass those on to EMS so they maintain a record, enabling them to respond the next time the client has an incident. This continues until all pathways are completed, and further follow-ups continue indefinitely. Here's an example of the system. The community healthcare worker is logged in. Each participant, nurse coordinator, supervisor has their own logins. The nurse coordinator has a screen to assign clients to CHWs. The nurse coordinator can get at-a-glance CHW performance information for each of the CHWs to see what the current status of the pathways and the steps for each client under their control is. CHWs can generate and assign pathway instances to their clients, and CHWs also get at-a-glance client pathway status information. The total steps currently being engaged in, the number of pathways, the average step, the average completion. CHW can interrogate the state of pathway for a particular client, current pathway step, and can confirm its completion or not, and then can see the next required step and the time period in which it's expected to be completed. Along the way, the CHW will receive reminders about completion times, and the nurse coordinator will be notified if these completion times are not met.